We see arthritis all over the body as orthopedists, and patients present with arthritis of the big toe similar to the symptoms they have arthritis anywhere else, with pain, swelling, redness over the area that they're hurting. Arthritis of the big toe can be more difficult, can be a condition that's more debilitating because the big toe moves so much, and with every step. The average person takes a step 7,000 times a day. Those with arthritis of the big toe are often even more active than your average patient. That's why they have arthritis of the big toe. So you're talking about someone who is stepping on their foot 10,000 times a day. Well, when you have arthritis of your big toe and the big toe has to bend backwards as you vault over your foot, that creates a lot of pain. It creates a lot of deficits for the patients and limits what they're able to do. What I see when patients come to see me is that it rubs their shoe, that they have pain when they're, early on they have pain when they're participating in activities that put them up on their toes, such as running. Dancers often end up with arthritis of their big toe because they're up on their toes a lot. Telemark skiers or folks who enjoy yoga and up on their toe a lot can have arthritis of their big toe, and it's very debilitating and oftentimes takes them out of those activities they enjoy. The longer someone waits to come and see me, the more limited the options are. No matter when they come to see me, there are options. I always have an option to help patients with arthritis of the big toe, but those options become more limited the longer we wait. Early on, we're able to treat that with a topical anti-inflammatory, perhaps an oral anti-inflammatory, stiffen the shoe up with what's called a carbon or a graphite insert, take some pressure off. We can give them a little gel padding to pad up the bone spur so it doesn't rub as much, and very often that gets patients through for a number of years, and they're able to participate in sports and activities and go walking and do what they want to do and get on with life without having to go through surgery. Once we've tried conservative treatment, and very often patients will come to me having done that. They've seen their primary care provider or seen a podiatrist, and they've been through a number of these treatments. So oftentimes they come and they've tried stiff-soled shoes and anti-inflammatories, and they come and say, I just need something else done. And after having that conversation and examining the patient and talking through the risk and benefits that go along with any surgery, we often need to proceed with surgery to really get them where they want to be from a functionality standpoint. The patient is okay from a medical standpoint. It's always outpatient. The only time this surgery would ever be from an inpatient standpoint would be a sick patient, someone who has a heart condition, has a significant medical condition that precludes our ability to perform this as an outpatient surgery safely. But otherwise, it's always outpatient surgery. And then it depends on which surgery we need to do, and that would be, again, based on radiographic and clinical examination. Usually we can just go in and clean up the arthritis, take off the bone spur, have the patient fully weight-bearing right after surgery. They can fully walk on their foot right after surgery, normally elevate their foot for a couple of days just to help with the swelling, but they're up and around very quickly with that surgery. That's different than another surgery, and that depends on how much arthritis the patient have. If it's bone-on-bone arthritis and pain with any motion, if they really just hurt with any motion in their great toe, then a lot of times they need a fusion or a partial joint replacement. The fusion is an excellent surgery. Patients can do almost anything that they would like to do. after a fusion. It's an excellent surgery with 90% good to excellent results. With that surgery, they're also able to bear weight, but really just on their heel after surgery. That's outpatient surgery. It takes about an hour to do that surgery. Able to walk on their heel, again, a few days that they're in bed with their foot elevated, but we have them up and around fairly quickly as well. With the fusion, we take the joint, take the arthritis out of the joint, prepare the joint, and put the two bones together so they grow together. Now we need to have to put some plates and screws. Sometimes we can just use screws. A lot of times we use a plate for stability until that bone heals together. Almost always the plates and screws can stay in. It doesn't bother the patient. 10% of the time it can rub a little bit and we can take it out, and that's a very fast 10-minute surgery if we need to take the hardware out. Most of the time patients don't want us to take it out because it doesn't bother them. After a fusion, you can participate in almost any activity. You'd be really surprised at how many activities are not precluded by a big toe fusion. To name a couple that do have to be modified, telemark skiers, those skiers where you really go down, the ones where you really go down on your knee back and forth, of those who are familiar with telemark skiing. But yoga instructors or folks who are interested, there's certain positions where you're way up on your toes that you're not able to do. People participate in yoga all the time after great toe fusions, so it certainly doesn't preclude yoga and pretty extensive yoga activities. But there are certain positions that are limited after a fusion of the great toe. You can, after the clean-out surgery, what we call a chylectomy. So after that first surgery I was talking about, we go and clean up the joint, take off the bone spur. I have you fully weight-bearing after surgery. After that surgery, that is often progressive, usually over a number of years, 10, 20 years, before you need something else done. But after that clean-up surgery and taking the spurs off, that can progress. After the fusion, that is a permanent solution, and you should not have further arthritis in that joint. It does put a little extra stress on adjacent joints, so the joints beside that joint can get some arthritis over time because that joint's now not moving, so other joints have to move. But again, that's usually a very gradual process and takes a number of years to progress.